Welcome to another podcast by Immunity Group. We are here with Adam Gavine, who is a practitioner in Wasabi Method, who has just come back from Dallas in Texas from the 10th Annual Biohacking Conference. Adam, welcome to Immunity Group Australia's podcast.
Thanks, Nina. It's a pleasure to be here.
So for the Australian audiences who have perhaps never heard of the Wasabi Method, can I ask you to just explain briefly what Wasabi Method is, how unique is it, what does it help with, and why do we need more wasabi in Australia?
That's a great question. It's not a quick answer either. So basically, Wasabi Method is we sell shockwave therapy devices. It's been a technology that's been around for over 30 years to treat, it helps treat soft tissues of the body. Predominantly, it's well known for treating tendons. It has about an 80 to 85% success rate at treating tendons, which are notoriously known to be recalcitrant, like very difficult to treat. So instead of people having to get like injections like cortisone or PRP or having surgery, it's a non-invasive treatment that uses acoustic sound waves to stimulate the body to heal and repair the area that we treat. One of the cool things that it does as well is it causes angiogenesis, which is the new formation of blood vessels in an area. So it's actually signaling the body to lay down new blood vessels in the area by causing the release of growth factors like VEGF and PIGF. So it also causes the release of nitric oxide, which most people know. It causes vasodilation and helps with getting oxygen to the body.
So it makes us younger potentially.
Yeah, definitely. Other things it does is it causes the release of stem cells, which we all know is helpful for healing and longevity and just overall health and well-being. Collagen is another thing. So a lot of people look at it for skin health and rejuvenation because our collagen decreases as we age, and that leads to wrinkles and less elasticity in the skin.
Can you use it for the face?
Yeah, you can. It's there are certain protocols that we sell, and that's part of the Wasabi Method. Is we're big on education, and so we will walk you through how to treat all the different areas, whether it's treating the skin, whether it's treating a muscle or a tendon or a ligament. You can even treat nerves. It helps with peripheral nerve, like neuropathies. It's been shown to increase nerve reinnervation. So if you have, say you have a nerve problem in your sciatic nerve, something like that in your leg, we can treat that area and help the nerve essentially heal and regenerate to a certain degree. And we're not going to get someone who's paralyzed, walking again. But if someone has a little bit of decreased sensation or motor function in an area, after a certain amount of treatments, they've been able to show clinically that it has an effect.
One of the most amazing facets of this new method is it can treat erectile dysfunction. Can you tell us why and how?
Yeah, that's a great point. Is you can treat erectile problems with the Wasabi Method because it helps with angiogenesis. So a lot of men, the problem why they have trouble getting an erection is because the vascular flow to the penis is inhibited, or they have some kind of systemic condition, cardiovascular problems that can cause them not to get adequate blood flow to go to the penis. And even if they can, it's maintaining an erection for long enough to have intercourse. So if we cause angiogenesis, we're stimulating the arteries and capillaries in the penis to expand and to grow new ones. So it gives you more of a permanent solution or resolution of the condition, so that these men don't have to take Viagra all the time. They don't have to do, or some of them do like injections into the penis to get an erection. So it's giving them more of a permanent solution. Again, a non-invasive, very few side effects. You might be a little bit sore for a day. That's the maximum. And you only have to have about 6 treatments to get a clinically significant effect.
Is there an age limit to that?
Yeah, you have to be an adult, so only 18 years of age and older, but there's no upper limit. We can treat 90-year-olds if they want to get it as well.
I think this is brilliant. Anything else that's sort of similar that people struggle with using drugs, but this could help without being invasive?
Yeah, we actually have a module on advanced techniques. You can treat burns, so burn victims. You can help the skin heal. You can help with, again, because you're helping with fibrosis, you're breaking down fibrosis. You're helping with the collagen, so you're helping regrow the collagen in those areas. Post-surgical, someone's got a big scar. Like I've got a woman just asked me this week if I could treat her C-section scar. Definitely can do that because it breaks up the fibrotic tissue in the area, and it helps healing, brings blood flow back into the area. So a lot of the time it's the blood flow gets impacted, so it doesn't heal or repair quite as well as it should. Other
cellulite?
Yeah, it helps with cellulite. Yeah, that's another one because, again, that one it's collagen. So if you increase the collagen, it fills in those gaps that people have in the skin and the fat areas. Other things, it helps with lymphedema. You can treat lymphedema. You can actually treat non-union fractures, so bone fractures that won't heal naturally because it causes the proliferation of osteoblasts. So the options for those are often they have to get surgical repair to help with that. So a hip's a common one. So you can get into the hip and stimulate the osteoblast to form, and it helps the bone knit together. One last one I wanted to mention was you can also treat like TMJ, so people with jaw problems, things like that. You can also treat effectively with our method.
In terms of female problems with vaginal area, what can it help with?
So you can treat the vagina effectively with shockwave and Wasabi Method. They're basically what it does again is you help with the blood flow to the area. Some conditions it helps with when some women have really tight pelvic floor muscles, which can make intercourse painful. And so when you're releasing these muscles and you're helping with the tone of those muscles, decrease the tone, you can make intercourse no longer painful. You can help with women that have trouble having orgasms. You can treat the clitoris with the shockwave. You sometimes have to use a little bit of lidocaine to help with the discomfort. But again, you're increasing the blood flow, you're increasing the nerve sensitivity to the area. So it's really, really powerful device if a woman's never had an orgasm, and that's the reason why, we can help with that.
And from some of your testimonials, women are absolutely raving how 10 minutes with you has pretty much changed their life. How come this method can react in such a quick time?
Yeah, it's good. It's a good question. Again, we're working on the physiology of the body. So we're putting signals into the tissues, the local tissues, to help heal and repair that area. So I tell people if I'm working on, say, your forearm, if you have like golfer's elbow or something, I'm telling your body, come here, treat this area, stimulate healing and repair this. It's like clean up on aisle 5. I say to people. So your body will respond, it will release all this chemical cascade, like I was talking about, the VEGF, the PIGF, the PCNA, the nitric oxide, the stem cells, collagen, all these things. You get a big change in the physiology so that the area can start to heal and repair. So it doesn't just work the day I treat you, it continues after. So it works the next day, the next week, the next month. They've shown in research that one treatment had up to 3 months, effects 3 months later. And
you mentioned that pretty much over 3,000 people gathered for the Biohacking Conference, yeah. And this method was obviously part of it. Yeah. Who were some of the celebrities there?
Oh, we treated a bunch of celebrities. If you follow us on Instagram at Wasabi_method, you can see videos of us treating Dr. Daniel Amen, Damon John, who's the founder of FUBU and a Shark Tank. We also treated, who else did we treat?
Quick.
Dave Asprey. We treated Christian Drapeau, who's the founder of STEM Regen. Yeah, so you can see videos of us treating those people and their reactions to the treatment.
And what was your highlight from the 10th Annual Biohacking Conference in Dallas?
Oh, I think it was just the whole experience. We unveiled Wasabi Method at the conference. So it was super exciting. It was stressful, but it was super exciting to kind of unleash Wasabi Method on the
So you had to keep it quiet.
Yes, I did. I kept telling people, we're doing something big and I can't divulge too much because there's non-disclosures and all that. But it was amazing. We actually had the busiest booth in the entire exhibit hall. There's over 100 exhibitors, and we had queues all 4 days. And like the complaints we were getting were people were like, I didn't get time to get a treatment because the queue was too long.
Wow. And in terms of other colleagues from across the states, how do you envisage the Wasabi Method to sort of expand over the next couple of years?
Well, we're hoping it will expand rather quickly because one of the different things that we do as a company is we're actually willing to sell our device to non-medical persons. A lot of the big companies, like the company I used to work for, one of the biggest shockwave therapy companies in the world, they refuse to sell to non-medical, even though FDA has given a class 1 approval, which means it's essentially treated like a massage device. And legally, non-medical people are allowed to use it. They just refuse to sell to them because of liability and stuff like that. So we've gone a step further and we've developed a comprehensive education modules so that these people can learn how to do the treatments safely and effectively. But the caveat is if you're non-medical, you're only allowed to treat yourself because you need a license to touch other people and you need liability insurance to actually treat others, which you can get if you're like a massage therapist. If you get a massage therapy diploma, that covers those things.
And is there an upcoming conference in Australia that you think this would be discussed at or even demonstrated?
We don't have any conferences currently here, but we're looking at developing more things available here and maybe doing some seminars and stuff like that. But we'll also have some face-to-face seminars we'll be doing in the United States, hopefully later in the year.
And how many practitioners are involved?
What do you mean by?
How many Wasabi certified educators right now and practitioners do you have?
We're quite small because we're brand new. So that's what we're having people email us daily asking where we have practitioners. And unfortunately, I'm like, we don't have any in your state because we're only 2 months old. So we're selling devices every week and getting more and more practitioners on board. And in a year's time, it'll be a much different story once we've been to several conferences and been promoting it and selling the devices. So
Australians are quite lucky to have access to you with this method in Australia right now.
Yeah, you can book in to see me. That's easy. You look me up on Back to Function or backtoffunction.com.au. You can come see me. I have a clinic in the Central Coast and 2 clinics here in Sydney. Even if you just want to contact me through email or something like that, you have some questions or concerns about where you can find a good practitioner, I can help you and put you in touch with the right people. So as a sort of piece of advice for our listeners, what is your personal biohacking advice to people who are not familiar with biohacking? What is a quick tip which perhaps somebody could implement straight away? I think an easy one is start with the things that don't cost a lot of money, the simple things that you can do. So like going outside, getting some fresh air, grounding yourself, getting some vitamin D from the sun, little things like people aren't aware that if you wear sunglasses, it blocks most of the vitamin D that you create is from your eyes. So when you're wearing sunglasses, you're blocking the UV rays that stimulate the vitamin D. Or with skin, you need a lot of your skin exposed to the sun. Like if it's just your arms and legs, you won't make a whole lot, but if you have part of your torso exposed to the sun, you make a lot more. Other things like biohacking for sleep, make sure you have a dark room, make sure it's cool. You can have some white noise in the background. Make sure you try and go to sleep at the same time every day. So don't, if you go to sleep at 11 o'clock at night, that's probably not ideal for your circadian rhythm. You might want to go to sleep at between like 9 and 10 will be more ideal, but try and keep it around the same time.
And one of your subspecialties or passions has been the perimenopausal women.
Yeah.
And can you tell us something about that? Because that whole term is something that is being talked about more and more.
Yeah, so I have probably 65, maybe even 70% of my patients are females. So a lot of them come in with conditions that are affected by their hormones. So for instance, one that's very common is gluteal tendinopathy. So they get lateral hip pain. They all get told by their GPs and stuff that it's bursitis, and it's not bursitis. They've done some big studies to show. They actually did one study where they removed the bursa, and the people still had pain. So it can't be bursitis if you don't have a bursa there anymore. So that really opened my eyes a few years ago. But what happens is when estrogen goes down, it makes your tendons less elastic, and then they're more prone to fraying and tearing. So most women that come in to see me with lateral hip pain that are around 50 years old, I pretty much already know what it is. I just push on their greater trochanter and I go, does it hurt here? And they all jump and go, ah, yeah. So the cool thing with Wasabi Method is you can treat that effectively. So I'm gonna, again, what I said before, the treatment is super effective for tendons. So if you go to your GP or some other specialist, they'll probably want to do PRP or cortisone injections or sometimes just exercise. Now exercise is part of what I do as well, which is kind of part of the method. So it's not just the shockwave. So I'll give you shockwave. I'll tell you things to avoid, like you might not be able to lie on that side or sleep on that side for a little bit because it restricts the blood flow to the area. Other things you can do is some exercises. Avoid like crossing your legs because that puts tension on that. So I got to get women to not cross their legs.
That's a big advice, isn't it?
Yeah, because they're doing stuff every day that's perpetuating the condition. So I tell people there's 3 ways to get better. Stop doing the things that make it worse or piss it off. Start doing things that make it stronger, more resilient, more functional, and then come and see someone like me to get some body work done. And if you do all 3, 1 + 1 + 1 is 12. So they have a synergistic effect. When you combine them all together, they work much better than any one by themselves.
Adam, I think that was brilliant. Thank you so much, and we hope to speak to you soon.
You're welcome. Thank you so much.